Dr. Rajesh Singh is a scientist at the National Institute of Hydrology, Roorkee, and he is an awardee of the prestigious Water Advanced Research and Innovation Fellow by Indo-US Science and Technology Forum and Government of India. Dr. Singh is a member of BIS Public Drinking Water Supply Services Section Committee (SSD) and has served as a member of various committees constituted by Honorable NGT, MOWR, GO UK. Dr. Singh received his MSc and PhD in chemistry from VN South Gujarat University, Surat. He is actively involved in research, training, and consultancy activities related to water quality and pollution amendment in the National Institute of Hydrology, Roorkee, since 2011.
Thank you, Mr. Varun, for the nice introduction. And first of all, I would like to thank Dr. VC Goel and Dr. Jyoti Patil for giving me an opportunity to interact with you all in this webinar on water for public health. I would be interacting on the impact of sewage effluents on drinking water sources of Shimla city and ameliorative measures to improve public health. A lot of jaundice patients uh, were there during this in a short span of time, and as we all know that the jaundice is because of the ingress of drinking water which is contaminated with microbes, and especially if the drinking water is contaminated with sewage, then there are chances of uh, infection with this jaundice. So because of this, the Irrigation and Public Health Department of Shimla City, they approached NIH to assess the reasons for the spread of jaundice uh, in the Sanjoli Malyana region of the Shimla city. And accordingly, we tried to investigate what are the reasons for the spread of jaundice in this area. Now, the methodology that was adopted by us was first the analysis of basin characteristics of Shimla city to understand the movement of water in the study area, then assessment of water quality parameters in the drinking water sources and sewage effluents of the study area. Then we also tried to find it out whether the sewerage network that is laid down in the study area if, that is suitable or that is efficient to take care of the load from that area. And then the source identification of sewage effluents influx in the drinking water. And finally, the knowledge which we gained from this study that was disseminated to the line departments and the people of the study area. So this was the methodology which we adopted for this study, which was mostly investigative in nature. So coming to the basin characteristics of Shimla city, I'm not going to discuss much about the characteristics, but we will I will discuss a little bit about uh, the, the drainage pattern of the area that was impacted, that is Sanjoli Malyana region. And here, this blue dot, this is the intake point for the water treatment plant that was supplying to water to this drinking water to this area. As well as there is one other water treatment plant, but this was the major uh, this was supplying the major amount of water to the people. And here the red dot, that is the sewage treatment plant. So this is the Aswani Khad stream from which the water is supplied to the treatment plant. We will be discussing more in detail. And this sewage treatment plant, it was discharging its treated effluent into this natural stream. Apart from this sewage treatment plant, the water was also receiving water from the habitation. And when this plant was designed at that time, these streams were quite pure, and but over the period of time, the population increased, more habitation was there, and more constructions of buildings. So the streams which were carrying water into the mainstream, so they also get contaminated because the sewage from the adjoining area were discharged into these streams, and then they were ultimately contaminating the mainstream. So these are some of the characteristics of the water, and one interesting thing is the mall road. So the mall road is this blue line, and this bifurcates the two watersheds in Shimla city. One is Satluj Basin, and the other is the Yamuna watershed. So it is so the mall road is on the highest point in the study area. So as we all know that the sewer lines and the drinking water lines generally run side by side, and the first thing which needs to be investigated whether there is some leakage from the sewerage lines, and that is being increased by the drinking water line, because drinking water supply is not continuous, and whenever it is stopped and then again started, then it sucks the water if there is some leakage in the pipeline, and if there is leakage from the sewerage line, then this uh, dirty water from the sewerage line, or leakage from the sewerage line, that is being sucked by the drinking water, and then it appears in our taps. So the first thing which we did is to check whether the sewage network is of the required capacity or not. And for that, we use the SewerCAD software. Now, the first thing which we did was to digitize the sewerage network of the area, which takes a lot of time. And then we entered the data that is pertaining to the manhole, conduit, outfall, and population load. So these are some of the information that is required for the manhole. That is, we need to know, enter the identification number. This is required because then only the software will tell which manhole is having problem, then the bottom and top elevations, upstream manhole data, downstream manhole data, and the manhole loading data, that is how much sewer is expected at that manhole. Then the data regarding the conduit, that is length, shape with dimensions, material of construction, these are required to understand that how the flow will be there in the conduit. And finally, the data pertaining to the outfall, that is elevation and invert elevation. So after running the SewerCAD software, uh, this is the elevation profile which we got for the sewerage network. So there were three sections of the sewerage. It was divided into three sections, and we found that the elevation profile was quite smooth, as well as the capacity of sewerage system that was laid down, that was also quite uh, uh, quite quite efficient to take care of the load. So from the SewerCAD run, we were able to conclude that the existing sewerage network was sufficient for the designed sewage loads. So the leakage from the sewerage network, or the contamination of drinking water from the sewerage network, uh, was ruled out. And then we also checked with the IMPS department regarding the connections to the sewage network. And surprisingly, we found that at that time only 25 to 30% of the habitation was connected to the sewerage system. So therefore, the total load that was going into the sewerage network was very less than the designed load, and hence the overflow from the manholes were completely ruled out. Uh, However, when we went for the field surveys, then we found that several manholes were overflowing. But they were overflowing not because of the inefficient carrying capacity of the sewerage network, but they were overflowing because of the blockage of pipes because of polybags, jute bags, and so this can be completely eliminated by proper monitoring and cleaning of these polybags or jute bags from the system. And we also found that there were some leakages in the drinking water supply lines. And if the leakages continues, then this will lead to ingress of the contaminated water into the drinking water supply line, and which may lead to the diseases, several diseases in the people consuming this drinking water. So therefore, we asked the INPH officials that the leakages should be properly attended, and they should be attended in a short time. So you can see here on here the leakage uh, that was attended like this, and this is not this right way to attend the leakages. So that was informed to the people that officials that this should be attended in a proper way. Then coming to the water quality monitoring, and water quality monitoring is required because this can only tell us that how much contamination is going to the people's houses and what are the reasons for this. So as I discussed in the beginning, that jaundice cases were mainly located from Sinjoli Malyana region, and this area actually this receives water from Aswinikhad water treatment plant and Halli water supply scheme. Now, the water supplied from Aswinikhad water treatment supply scheme is the major one, and Delhi constitutes a very a fraction of this. And after investigating the inputs to Aswinikhad water treatment plant, we found based on our field investigations that uh, it takes water from a natural stream. However, this natural stream again was getting water from the Malyana STP treated water, and three open drains, that is Housing Board Colony drain, Sanan open drain, and Siu Mandir drain. So these were the major contributors to this to the Aswini Khad stream. And we found that all these streams, so therefore all these streams were a bit contaminated, and therefore monitoring of these streams was required. So we started monitoring it, and we monitored for almost a year. And based on that, I would be discussing with you some of the results which we got after monitoring. Then the other source of water to this water treatment plant was the bore wells, and these bore wells were fulfilling the demand during the lean period, or when the water was not sufficient in the Aswini Khad stream. So, based on these observations, we collected samples from the WTPs, sewage treatment plants, bore wells, open drains, as well as the user points to understand that what is the quality of water that is reaching to the people. And finally, we came to certain conclusions that if this can be avoided, then the water pollution-related diseases in this area can also be avoided, and this is actually applicable to every water treatment scheme. So first we will discuss about the sewage treatment plant. And I looked at the sewage treatment plant that was erected there, and it was based on the extended activated sludge process. And this treatment plant was designed in a very good way, and it was designed in such a way that when taking care of the fluctuations in the temperature of the Shimla city. So in the winter time, when the temperature is very low and the microbiological system efficiency goes down, so for that the designers or the water treatment supply scheme, sorry, the sewage treatment plant suppliers, they had given a solids contact clarifier so that through the chemical treatment, the contamination or the suspended solids as well as the BOD, COD can be reduced. And this is designed to treat 4.4 mld of sewage with 375 milligrams per liter of BOD. And as the figure shows, it is having a bed chamber, one aeration tank, secondary clarifier, solids contact clarifier, sludge handling system, and finally the calcium hypochlorite dosing system to get rid of the microbial contamination in the treated water. But as I told, the system was properly designed, but when we surveyed it, we found that it is not performing as per the design. And as I has observed in many treatment plants, whether it is water treatment plant or it is sewage treatment plants or effluent treatment plants, the operators actually they made few changes in the treatment system or in the operation philosophy, and most of the time this change it leads to a disaster in the treatment system. And the same thing was happening here, which I will discuss in the coming slides. So, coming to the results, we found that only 30 to 40% of reduction in BOD is taking place. Now, this high organics in the treated water was because of suspended solids due to poor settling. Now, here, if you will see, this is the secondary clarifier. And generally, this type of scum, such a high concentration of scum is generally not encountered in the secondary clarifier. So what has happened here in this treatment plant, the operating team as well as some of the people from the IMPH department, they thought that why we are circulating so much of sewage settled sludge from the secondary clarifier to the aeration tank, and if we stop recirculating it, and if we recirculate it once or twice in a day, then we would be saving a lot of energy. Now, this was good for good concept for saving energy, but one need to understand that why this recirculation of sludge is being done from secondary clarifier to aeration tank. Now, this recirculation is done for two reasons. One is that we want to maintain a certain amount of MLSs in the aeration tank, because they are going to biodegrade the organic matter that is coming along with the sewage. So if we are collecting the all the microbes in the secondary clarifier, storing it, then certainly the MLSs or MLVSs in the aeration tank will reduce, and because of the reduction in the bacteria in the aeration tank, the overall efficiency of the treatment system will reduce. Then when we are storing the microbes in the secondary clarifier in anaerobic uh, condition, then the septic condition develops, and at the same time, since the organics is not so much in the secondary clarifier and lot of microbes are there, so they become starved and they start eating each other. So what we are doing, we are reducing the active microbes or active bacteria in the system. And and when the septic conditions develop, then a lot of H2S gas starts producing at the bottom where the bacteria are there. So because of that, the dead biomass as well as the active biomass, they starts appearing on the surface. And because of that, the scum was observed in the secondary clarifier. Now, when we are recirculating this biomass into the secondary clarifier, which is now septic in nature, so it will reduce the oxygen of the aeration tank, and hence during that period when we are circulating the activated sludge in the aeration tank, the efficiency of the system will again go down. So that's why, although the system was designed properly, because of change in the operation philosophy, the performance has severely reduced, and lot of suspended solids um, as well as BOD was escaping from the system. So So therefore, what was required? Actually, what was required is the in the system is the recirculation of the sludge, settled sludge from the secondary clarifier continuously, as well as the operators, they can monitor the dissolved oxygen in the secondary clarifier. And if it is around zero point 0.1 ppm or a bit higher than 0.1 ppm, then that is the amount of circulation that is required. So this was again, we informed the people or the operators that they should operate it in proper way. And second, what we found is the solids contact clarifier. The solids contact clarifier, again, they wanted to uh, save the power consumption, and because of that, they were not running the scraper. Again, if you are not running the scraper, then the solids contact clarifier is just like a settling tank, and it will not perform as per the design. So that was again a problem, and so we suggested them to uh, operate all the units in a proper way. And here you can see, sorry, I forgot to explain this picture. So this is the inlet. This is after secondary clarifier, and this is after solids contact clarifier. You can see that the suspended solids concentration got increased as we are moving down the treatment chain, which is certainly not required and which is not expected. What we need is that the suspended solids as well as organics in should reduce as we move down the treatment chain. And all of this was because of the inappropriate operation of the treatment units. Then in last was the chlorination, and they were dosing lot of hypochlorite, sodium hypochlorite into, as well as calcium hypochlorite, most of the time calcium hypochlorite. And because of that, in that way, they were trying to reduce the organics that was going into the treated water. But actually, we should also need to understand that if we are oxidizing the organics with help of bleaching powder or any OCl containing chemical, then it results in formation of trihalomethanes, which are carcinogenic in nature. So although we were not investigating whether the water was carcinogenic or the people are suffering from cancer, but this type of uh, treatment, uh, like dosing a lot of hypochlorite to get rid of the organics, this leads to trihalomethanes, and we found presence of trihalomethanes in the drinking water. That is the water that is reaching to the people, and certainly the people, if they will consume this water for a long time, then they may develop cancer. So what I wanted to emphasize in this slide that we should try to remove as much organics as possible in our biological treatment system or in the solids contact like fire, and this dosing of hypochlorite, that should be only for the disinfection of treated effluents, and it should not be used for removing the organs. Then the open drains, which were contributing to the flow of the Asuni Khat stream, we also monitored those, and we found that the COD was in the range of 100 to 400 milligrams per liter, and nitrate again was in the range of 15 to 45 milligrams per liter. This clearly indicates that the water that was flowing in these open drains, uh, they were mostly sewage, and this needs to be stopped, and the sewage should be properly treated, and then only it should be discharged in the natural stream. Uh, and this was expected because only 25 to 30% of habitation was physically connected. So around 70 to 75% habitation was discharging the sewage in these drains. And here you can see that when we surveyed the area, then this type of septic tanks were there, toilets are there. Then this type of open defecation practices were also taking place, and all this feces, fecal material from the septic tanks as well as from the open defecation system, that was finally going to the natural stream either in the monsoon season or in the normal days along with the rains. Then the kitchen and bathroom drains, they were also not connected to the sewage drains. And we suggested that this also should be connected because the kitchen and bathroom drains, although they does not contain a lot of organics, but still they contain organics, and uh, this gives good, this is a good substrate, or this is a good food for the microbes to proliferate and increase their numbers in the streams. So, and the water quality deterioration of the open drains was also due to the malpractice of throwing garbage. So, if you will go in any hilly town, you will find this type of scenery in the drains, whether it is Masuri, whether it is Nainital, or whether it is Simla or any other place. Now, this garbage which is there in the open drains, they are a good source of organics for the microbes, and microbes start growing in these streams or on this garbage, and ultimately after some time they start appearing in the water of that stream. So if we want that the water should be clean, then what we need to do, we need to avoid throwing the garbage in the open streams, and this should be disposed properly in the solid waste management systems or plants. Then, surprisingly, we also find something interesting, and we did not investigate the reason for that because we were not having enough time. But the Shimla Municipal Corporation has set up a full-fledged solid waste management plan, and that was very near to this site. But we found that uh, the solid waste was dumped here in the open, and that will again lead to contamination of the natural resources because of the leachate that emanates from these dumping sites. Now, again, one problem with these leachates is they are low in pH, and when they interact with the uh, sediments, then they start leaching the trace metals that are present in the sediments, and the water finally gets contaminated with the trace metals or other contaminants that are present in the sediments. So this type of thing also needs to be avoided, and we asked the authorities to take care of this type of dumpings or to avoid this type of dumping. Then coming to the water treatment plant, as I told that there were two water treatment plants. One is Aswini Khad water treatment plant. It derives its name from the Aswini Khad, which is Aswini stream from where it was extracting water for treating. So this is 10 MLD water treatment plant, and so this is the treatment scheme. So it was having a calcium hydrochloride dosing system in the beginning, but I don't know why that was eliminated later on. So they stopped dosing chlorine at this point. Alum was dosed and then a flash mixture. So this is the flash mixer here in this picture, and then there were three sedimentation basins. Now the overflow from the clear water from these sedimentation basins, they were filtered through the gravity send filter, and the chlorine gas has been started dosing, which and the fluorinated water was stored in treated water tank. Now this treated water tank, it also receives water from the bore wells whenever not enough water is there in the Aswini Khad. And in fact, I found that even during the monsoon period, uh, the, the Aswini Khad was not able to supply the desired amount of 10 MLD to the treatment plant, and therefore these bore wells were supplying the water for drinking purposes. Now this treated water again goes to a Kawalar pumping station, and finally to another pumping station. I am not able to remember the name. And everywhere at all these pumping stations, they were dosing chlorine gas. So I will discuss that how much chlorine gas was dosed because of a lot of organics in the water. So, coming to the Dhali WTP, it is a small plant. So there are two schemes. One is from Churat Nala and another is from Sayok catchment. The Sayok catchment, it receives water from a dense forest area, and this scheme was very old scheme from the predecessor time, and still since the Sayok the catchment, it is still pristine, so no pathogens were detected in that water, and that was still good. So just what they are doing, just passing this water through a slow and gravity filter to remove the suspended solids if any, and then that is supplied for drinking after chlorination. But this Churat Nala, actually, it is a little bit contaminated, but It is because of that it is treated with chemical, that is LM and lime is added to precipitate the suspended solids. So this is the settling clarifier for this scheme, and the clear water from the sedimentation tank is filtered through gravity send filters, and this water after chlorination is supplied to consumers. So very little contamination was there in this treatment scheme. So that's why we concentrated more on the Aswini Khad water treatment plant to find it out that what are reasons because of which the water of that treatment plant is getting contaminated. So already I have discussed with you the various reasons, and here this graph shows the organics in the different treatment plants, and here you can see that the the Dhali water treatment plant, the organics, so this is the COD. COD was very low, and this I am talking about the, the, the scheme from the Churat Nala, and so this is the COD in the Churat Nala scheme, the inlet, and this is the fecal coliform in the Aswinikhad water treatment plant, and fecal coliform in the Dhali water treatment scheme, and this is the COD inlet to Aswinikhad water treatment scheme. So a lot of uh, organics were there in the Aswinikhad. Then this is about the bore wells. So total coliform, COD. So we analyzed the two bore wells, and that is presented here. The results of that, and you can see that even the bore wells were having a lot of organics as well as coliforms in them. So having said that, these bore wells or the groundwater for these bore wells, it is being recharged from the Aswini Khad, which is highly contaminated, which was highly contaminated, and because of that, even the bore well water was contaminated. So that is supplementing water to the Aswini Khad, and hence a lot of organics as well as polyforms were there. So what we concluded from this is that Aswini Khad WTP, it is designed to treat natural stream which should be just having some organics in some a little bit of organics and suspended solids, and it should be having very little amount of coliforms. But here, over the period of time, because of change in the land use and uh, uh, lot of sewage is coming into the stream that needs to be treated from the treatment scheme that is supposed to just remove suspended solids from the water. The situation has become worse, and therefore the technology needs to be upgraded for the present scenario. So we also suggested them that what technology is suitable for that, which I will be discussing later on. Now, this is regarding the chlorine and the consumption of chlorine. So here you can see how much chlorine is dosed. So so this is the Aswini Khad water treatment plant where chlorine was almost zero, and then in the chlorination tank, so they were dosing quite a huge amount of chlorine, and there we found around 25 milligrams per liter of chlorine, which got reduced to 1 milligram per liter at the user point. Now, apart from that, the uh, INPS department was dosing chlorine at Kavala pumping station as well as the Sumti reservoir. So they were dosing to maintain the chlorine, and with this high doses of chlorine, they were able uh, to achieve 1 milligram per liter at the user point, and were able to avoid the jaundice cases at during the time of study. But then we tried, we analyzed the samples for the presence of organic halides, and we took IR spectra for that, and we found that presence of organic halides at the user point. Now, calculating the chlorine consumption for removing the COD, so COD was around 35 to 50 milligrams per liter in the filtered water, and which reduced to 15 to 25 milligrams after chlorination at the user point. So this indicates approximately 50 milligrams per liter of consumption of chlorine at the water treatment plant. And if we add 25 milligrams per liter of residual chlorine that we found, then the chlorine doses comes out to be 65 to 75 milligrams per liter. So we were dosing a lot of chlorine to the treatment plant, and this was able to result in pathogen-free water, but it also leads to formation of organic halides, which was confirmed by the IR spectra, and this may lead to cancer in the people consuming it. So, so what does this mean? This means that we need to remove the organics in the treatment plant itself, and that should not be removed through chlorination. And talking about the user point, so all the parameters were at the user points were almost similar to what was there at the Kusumti reservoir. It was free for pathogens, and other harmful contaminants were not there. Then we analyzed the water for the bodies, which are springs actually. So Baudi is the local name for the springs, and few pockets of the study area they were getting drinking water from this spring. So we analyzed it, and we found that few springs were contaminated with organics as well as fecal coliforms, and those were identified and informed to the authorities that these springs should be isolated and they should not be used for uh, drinking water consumption. So coming to the conclusions and a way forward, so we found that the sewerage network installed in Sanjoli Malyana region is sufficient for designed sewage load, and elevation profile indicates smooth flow of sewage. Then the contamination of the Aswini Khad natural stream, which was supplying water to Aswini Khad, it was because of the poor connectivity of habitation with the sewerage network, discharge of kitchen and bathroom drain to natural streams. People were defecating in open, and the garbages were thrown in the drains. So that should not be there. And dumping of solid waste without an engineered structure reduce efficiency of Malyana STP. So this actually the reasons actually if we are able to avoid these issues, then the water that is going into the natural stream will be automatically clean, and the system will perform efficiently. Then the Aswini Khad WTP, it was designed to remove suspended solids and not organics and pathogens, as I discussed earlier. So therefore, it requires modification, and we recommended to install solids contact type clarifiers or active flow. Because of space constraint, they can go for active flow type of treatment system, and so that inbuilt sludge recirculation is there. So this type of treatment system actually, with the aid of coagulants and flocculants, it is able to remove organics and microbes from the water, and therefore very little chlorination will be required. Apart from this, they can also think of installing a physical barrier. like ultrafiltration membranes, so that the microbes as well as organics which are escaping from the chemical treatment can be removed, and then very little amount of chlorination is required, that is just for disinfection. Then they can also think of doing ozonation followed by chlorination. Chlorination is for maintaining a residual chlorine in the water, and ozonation for the disinfection and getting rid of some of the organisms. But any modification in system, actually, this should be done only after carrying out proper pilot studies. And once we get all the operating parameters, desired operating parameters, then only that scheme should be adopted anywhere, anywhere, yeah. And for the sewage treatment plant, as I discussed, that one need to maintain uh, at least zero point 0.1 to 1 milligram per liter of dissolved oxygen in the treated water from secondary clarifier, and that can be achieved by properly recycling the settled sludge with the periodic removal of biomass from the system. And then the tertiary clarifier or solids contact clarifier is it should be operated properly to remove the suspended solids that were escaping from the secondary clarifier. Finally, all the WTPs and STPs should be uh, periodically evaluated and audited to avoid this type of problem that has happened in future. So with this, thank you very much. I hope I had explained all the reasons because of which the jaundice spread was happened spread happened in this industry. So thank you.